Hi, I'm Leslie, a sports physiotherapist. Thank you for visiting our website. Today we're talking about the most common shoulder injury which affects many athletes, especially in racket sports. It is rotator cuff tendonitis. So what is the rotator cuff? Well, the rotator cuff is a series of muscles that basically controls the movement of the shoulder. As you can see, the rotator cuff muscle forms a tendon, which we've indicated by these lines here. Unfortunately, the tendon actually passes underneath what they call the acromion, which is a bone. Okay, so with movements such as lifting up the shoulder to one side, okay, usually pain would occur at about 90 degrees. If you're playing tennis, the most common stroke would be obviously the service action, which would cause pain in the shoulder itself. Other things could be the backhand or backhand volley, the high backhand volley. Okay, and all these things would bring on pain with rotator cuff tendonitis. With rotator cuff tendonitis, you basically get inflammation of the rotator cuff tendon. It's quite a painful, debilitating injury, simply because you are required to use your hands for virtually every task during the day, and it could be as painful as even opening a door, closing a door, and you might even feel pain, reaching to one side for an object, and you might even bring on the pain itself. But exceedingly common, really very common in many individuals. So the older you get, the blood supply to the tendon actually drops. Okay, and of course this tendon actually has a notoriously poor blood supply. So of course the older you get, the more prone you are to injuring your rotator cuff tendon. Now, the more serious type of injury is not a rotator cuff tendonitis. It can actually be a rotator cuff tear. Usually rotator cuff tear occurs in the older population, and it could happen when you fall down, you fall on your arm, or maybe in sport, a violent sport like rugby, or some type of impact to the shoulder itself. But you can get a rotator cuff tear chronically, meaning that through training and overuse, you can actually develop from not just a rotator cuff tendonitis, but one step further to rotator cuff tear. And it's usually very painful. So painful that even hanging your arm in this position might be painful. So people will actually have to carry their arm, okay, to take the load off the rotator cuff tendon. Because the rotator cuff tendon basically wraps around the ball, okay, the ball of the shoulder. And if you imagine the ball and socket joint that forms the shoulder, the rotator cuff tendon literally wraps around the ball itself. Okay, so it controls movement of the shoulder, particularly this movement here, external rotation and internal rotation. And this movement is what we're going to focus on at a later stage. Now, it's very common for runners to get hamstring tightness with overtraining. The same goes for the shoulder. Think of the rotator cuff as the hamstring for the upper body. So with sports like tennis, badminton, any type of sport that requires you to use your arms a lot, okay, rowing, dragon boating, what you're going to get is very tight rotator cuff muscles. Now, as you can see from the diagram, the rotator cuff tendon actually starts in the shoulder joint, but you can see the muscles trace all the way down into the shoulder blade. Okay, so to take the pressure off the tendon, it helps to actually improve the flexibility of the rotator cuff muscles. Now, the rotator cuff muscles basically envelop the scapula or the shoulder blade, and the best way to loosen them up, okay, is to use a trigger ball. Now, some people actually use a tennis ball such as this. It's best to do this exercise on the floor. Okay, so what I'm going to do is basically our model's going to lift up, and all you have to do is just slide the ball underneath. Okay, then place it on some towels, and the body weight will drop on top of the ball. Now you might have to angle the body so that you're basically slightly facing up. In the hand position, you can either rest it on your head or you can let it drop down. Now you don't really have to move around as such, okay? You just basically have to find the spot that hurts and just hold it there for 20 seconds. Okay, now you can do it for 30 seconds, 1 minute, but 20 seconds is a good start because it is quite a painful exercise. Once you've done one spot, we're going to move the ball to another spot. Okay, so this is called trigger point therapy. It's very effective at breaking down the tight muscles here. Swimmers do this exercise a lot as well because they need really flexible shoulders. And this will improve your flexibility, okay, and even your swimming performance if you do this. Now for tennis players, of course, the service action. So important in tennis, and it's good to have very flexible, very loose shoulders, and this definitely does help. I can guarantee the professionals would spend a lot of time doing this type of exercises, okay, to basically not just improve the performance but to prevent injury. Because with training, it will naturally get tight. As you start to train more and more, the rotator cuff muscles start to basically tighten up, load of them increases, and of course you need to play an active role to actually manage the condition. So now we're using a trigger ball, okay, and again we're just changing spots regularly, okay, and it is quite painful, and you want to find the painful area and work in that area. Another strategy for treating the rotator cuff tendonitis is to actually strengthen the tendon. Now, the package that you have purchased might contain a few different color rubber bands. We're going to call them TheraBands. So there's green, there's red, there's blue. We're going to start off with the red one because it's the lowest resistance, and it's up to you to actually progress it accordingly. Okay, so a good number, you should be able to do about 20 repetitions. If you can't do 20 repetitions, it means that the resistance that you have chosen is too strong and you have to choose a lighter resistance. So what's the basic rotator cuff strengthening exercise? Okay, well, this is it. What you want to do is start in this position. You might notice that the rubber band in this position, or a TheraBand, is very lax, okay? So if that's the case, you need to step further away, okay? Until this is no longer lax. So from this position, right, we're going to rotate out, okay, to this position. Now you might find if you go all the way out, it might actually be a little bit uncomfortable. So it's not necessary to go the full range of motion, alright? But it is necessary to start in this position. Make sure your wrist is touching your stomach, okay? Make sure this is not lax, so you might just stand further away again, okay? And then pull out, alright, to 80% the full range, alright? And this is the standard rotator cuff strengthening exercise. Strengthens the muscles of the shoulder, strengthens the rotator cuff tendon, okay, and it's very, very important. Should be able to do, like I said before, 20 repetitions, have a rest of about 30 seconds to 45 seconds, and then another 20. How many sets should you do? About 4 sets, so 4 times 20. Now some people actually tie this to their car door, or at every single traffic light they'll do this exercise. You can tie it to anything, a handle, shower rail, okay? So anything at all that you can fix the TheraBand to. The common mistake people make as well is at the elbow, okay? Some people actually elevate the elbow like that. There's a big gap there, so that's incorrect. You want to keep it nice and close to your body. And in fact, using a towel sometimes is a good reminder. So we're going to place that there, and then we're going to do the same exercise. Okay, and don't let that towel drop. So you have to basically keep that towel there, don't let it drop. Perfect. Alright, so that's a good reminder. Now to progress this exercise, once again you can actually use a higher resistance TheraBand, okay, such as green is the next step up from red. Then after green, there's blue, and after blue there's black. Now the standard rotator cuff exercise that you saw just now is not quite challenging enough. There is something else you can do. You can actually train your shoulder in the position that you get the pain. Now with rotator cuff tendonitis, you will realize that most of your pain occurs when your arm is about 90 degrees. As you keep going up, the pain will still be there, and then it reaches a point where it actually disappears, and you might be able to get the full range without any pain. Okay, so there's usually what they call a painful arc, from about 90 to 120 degrees. Okay, so what you can do is train that rotator cuff in that position that you have that pain normally. So good exercise to do. Once again, we're going to get our TheraBand, alright, and all our model is doing is simply stepping on the TheraBand, and then he's going to get his arm to this position. Now make sure there's no pain right now, and you have to find something that is basically shoulder height. So you have to rest your elbow or your arm on the ledge or shelf, okay, and we're going to show you that movement now. Alright, that's it. Now like before, if you go all the way up, sometimes it is a bit uncomfortable, so it's not necessary to do the full range. Okay, so maybe 80% of the range, just like that. That's it. And make sure your hand, if you can, passes below the horizontal level. Okay, so you get as much movement as possible without causing pain. Alright, so like before, 20 repetitions, 4 sets. Just like that. Now, if this is not challenging enough still, and you want to actually challenge your shoulder a little bit more, Very simple. Just do this by yourself without anything supporting your elbow. Alright, and this is pretty much one of the hardest rotator cuff exercises that you can do. Now, the most important thing with all these exercises, there should be no pain. If it is painful, a simple thing you can do is, number one, use a lower resistance band, or number two, you can actually just do a static exercise, which means just holding it still in this position, okay? So no movement is required. Even this helps train the rotator cuff muscles. Now, age is a factor with rotator cuff tendonitis. As I mentioned before, the rotator cuff has a notoriously poor blood supply. And as you get older, unfortunately, the blood supply to the tendon diminishes. So any small injury takes longer to heal, and of course that cycle where you stress the tendon and then it heals, and of course that cycle. So any injury that you might have takes a bit longer to heal. Now, apart from age, the other thing that does affect the rotator cuff tendon is posture. You notice that the ball itself, the ball of the shoulder, is positioned slightly forward. Now, if you have a poor posture, if you slouch a lot, okay, so if our model slouches for us, and you can notice that ball itself kind of gravitates forward. And in this position, it's actually easier for what we call impingement to occur, which means that the bone of the acromion, as you can see in that diagram, actually presses on that rotator cuff tendon. Okay, it closes that gap between the tendon and the acromion, making it easier for the tendonitis or impingement to occur. So a good posture is actually a factor with shoulder injuries and rotator cuff tendonitis. So what we're going to do now is actually use tape to actually position the ball further back, and at the same time it helps support the rotator cuff tendon. Now we're going to use this brand of tape called Leuco. Now there's lots of tapes out there in the market. You know, there's some are white in color and different colors, but we find that the brown Leuco tape is the best. Why is that so? Simply because the adhesive is very strong, so it gets a good grip, and even if you're sweating, even for 2, 3, 4 hours, the tape will actually hold. And the other thing as well is that it's easy to come off, okay? It's actually easy to take off and it doesn't leave that horrible sticky residue that a lot of cheaper tapes do. Now, with taping, a good trick is to actually tape when the skin is dry and clean. So get a wet towel, wipe off all the moisturizing cream, all the oil in your skin, okay, and let it dry. And then, when you apply the tape, after applying the tape, don't jump on the cord straight away and start hitting the balls. Basically wait. Give about 20 minutes for the adhesive to actually activate and adhere to the skin effectively. So I normally would tape at home, and then I'll go to the court, and then once I'm there 20-30 minutes later, the tape is firmly fixed and you can do whatever you like. Okay, so how are we going to tape the shoulder? Very simple. We're going to start off with a strip of the Leuco tape. Now how long should it be? Roughly about the length of your hand. Okay, so it doesn't have to be precise. And of course it is a little bit of trial and error. Some people like it longer, some people like it shorter. So we're going to get the strip of the tape. Okay, now if you can see in this model, we've actually outlined the bony area, okay, by there. And then this is the tendon itself. So what we're going to do is basically cover this bony area. And of course everyone will have this little lump at the top of the shoulder, okay? It's actually part of the clavicle, part of the collarbone. And this little bone is our landmark. So we're going to start at the front here, just like that, alright? And then we're going to pull backwards. Make sure you have a good posture, so nice and tall, shoulders back, chest out, okay? And then you actually pull back, just like that. And you notice we actually covered that lump at the top. Okay, so one strip there, and then we're going to do another second strip. Now the second strip will be slightly longer because what we're going to do, we're going to overlap, okay, and it's actually in front. Okay, so we're going to start there, we're going to pull back, and you can see those wrinkles forming, okay, and then just like that. Okay, very simple. So we actually pulled the shoulder back. And at the back here, if you look at the back, we've actually overlapped the first tape. So it's actually longer than the first tape itself. Now with this taping, you'll find a dramatic improvement, right? You can actually test it out, move your shoulder, feel the pain, and then tape, and then do the same action again. And you should find less pain, or perhaps even no pain at all. So taping, very, very effective. And again, if you want to play, if you do have rotator cuff tendonitis, you should treat it instantly. Go to a physiotherapist, get it treated properly, because it is one of the more serious, difficult, complicated cases and injuries, and you don't want it to develop into a rotator cuff tear, okay, or chronic tendonitis. However, simple strategies like what we've shown you in the video, trigger ball exercises, taping, strengthening the rotator cuff, can make a great deal of difference. Okay, so I hope you found these strategies effective and helpful, and thank you for watching.